Homicide, The Wire. The mean streets of Baltimore have become the stuff of TV legend. But beyond the romance of fiction, there is a very real human story here of families struggling to survive and thrive under the most challenging circumstances. Here on the streets, life is hard, money is scarce, and health insurance is only a far-off dream. The numbers tell a frightening story. 10% of residents are unemployed. 34% live below the poverty line. 60% lack health insurance. Perhaps most alarming of all, 40% of all babies born in the Pigtown, Washington Village neighborhood are considered unhealthy at birth. That's a statistic that seems straight out of the third world, but it's actually happening right here in Baltimore, in the heart of America's powerful Northeast corridor. Refusing to accept these appalling statistics, in 1992, the University of Maryland School of Nursing, along with the generous support of corporate and private donors, brought Open Gates to the community.
For a couple of reasons, Open Gates is a really important initiative. One, the School of Nursing has, as I think its philosophy, to provide service to the community. There are many of the patients that come to Open Gates, or many of the families that come to Open Gates, would not go elsewhere if Open Gates was not in their community. One of the reasons they wouldn't go elsewhere is they would not find the kind of atmosphere in a care setting that Open Gates provides. There are residents of the community that work in Open Gates as outreach workers, and the model, again, the nursing model is family-focused and it's community-focused.
Pulse Place feels very fortunate to have a special relationship with Open Gates. Actually, Open Gates started as the Pulse Place Nurses Clinic and became its own nonprofit in the early 1990s.
The value of providing healthcare services in communities where folks live and work is that we are reaching people where they are. We're breaking down the barriers that a number of people have, especially poor folks have, to accessing healthcare services. And we're involving the community in the delivery of care. We're seeing folks as our partners.
Employing a unique approach to treating the whole patient, Open Gates succeeds where past practices have failed.
Every time we see a patient who's uninsured, I consider that a success, because if we weren't here, the uninsured would not be receiving services. There aren't a lot of community-based services for someone who has absolutely no insurance. And what we tend to see is then people go without health care until the situation gets so serious where they have to go into the emergency department. So every time an uninsured adult walks into our clinic, we have a measure of success, because that's what our commitment is, that's what our mission is, to serve the uninsured population.
For those that don't have access to good primary and preventive care, which is tremendously cost effective, they end up with serious consequences of chronic diseases or other conditions and end up in the much more expensive emergency rooms or hospital stays. The bottom line is anyone else who has insurance in our society pays increased rates to help cover the costs of uncompensated care.
At Open Gates right now, we're seeing over 6,000 visits a year. And our visits certainly have increased since we've been in our new building, and they continue to rise. I think that's a reflection of an increase in the uninsured population, and it's also an increase in word of mouth. As more and more patients come in here, more and more patients go out and tell their neighbors, friends, family members that there is a place in the community where the uninsured and the underinsured can get quality health care.
The true impact of Open Gates' work can't be summed up in mere numbers, but there is much that is quantifiable.
Those that are uninsured are predominantly the working poor and the working middle class. In Maryland, 84% of those who are uninsured either work themselves or live in working families. There's no question that it's far more cost effective, both for the clinic as well as the taxpayers at large and others who are insured around the state, that if you get primary care early on to people who are uninsured, you're going to reduce cost to everybody else.
Today, Open Gates is a state-of-the-art healthcare facility centrally located in the heart of the Washington Village Pigtown community. It's a new and progressive concept in care, managed and run by the nurses of the University of Maryland School of Nursing.
What makes Open Gates different is that nurse practitioner model that marries the clinical side and all our other programs. That it's not just about a visit to a provider, but it's about an outreach worker going out to the home to do education. It's about our nurse care coordinator going out to the home to teach the patient, to teach the newly diagnosed diabetic and what to eat and how to do a finger stick to monitor their blood. It's about working in partnership with the schools, getting children ready to go into first grade or into kindergarten. So that's what the nurse practitioner model is. It's not a traditional diagnose and treat, it's much, much broader than that.
Open Gates goes beyond healthcare to form alliances with state and federal programs that help children stay healthy through guidance, direction, and education.
We are very excited about the partnership we have with Open Gates. The parents are coming in. We can offer services that are up the street. We can explain to the parents where they can go for services. And it doesn't always involve having medical insurance. And that's the beauty of it sometimes. I see a difference in our parents. I see the younger parents coming in so they can learn. I see the parents that are grandparents here to get help. And I just think if our partnership continue, it will be very, very positive. And hopefully next year we have 100% in our attendance.
In short, Open Gates is making a difference in several ways, and community leaders are noticing that difference.
Having Open Gates as our next door neighbor means that we're able to partner on even more projects together in the years ahead. And together we're helping to anchor the 1100 block of Washington Boulevard and Ward Street.
And no one knows the value of this work better than the nurses and nurse practitioners who provide the care.
This type of clinic and this type of setting and this type of neighborhood is exactly why I became a nurse practitioner. To be able to make an impact in individuals' lives, to be able to function in a fairly independent manner, and to have a clientele, to be a part of a community and be recognized by the clientele that you serve as someone who can make a dynamic change within their life. Yeah, that's exactly why I became a nurse practitioner.
My son was a drug addict, an alcoholic and a drug addict. And when he came to Open Gates, he always come back and talk to me. Even though he lives way on the east side, he still comes to Open Gate. And he comes back and he talks to me now about Amy Barlow and what a wonderful person she is, how she takes time with him, how she doesn't look on him as somebody on the street. And my youngest daughter, she was in an accident and she was cut. She didn't have any insurance. And she came and how Matt took care of her. You know, these are stories that mean something to me because they're my children. And when my children are taken care of, that's the most important thing, when people see my children as somebody.
The clientele that you see in Washington Village, I should say, is kind of a microcosm of what occurs in every large city nationwide. And what's occurring at Open Gates could be a model for healthcare delivery for those microcosms that are occurring nationwide. And it's really something that could and should be supported and really looked at and could be exported and could be a very good thing for healthcare delivery in the United States.
Today, Open Gates' work is more critical than ever. The ills of urban society haven't lessened, while the cost of health care and health insurance continue to soar. This fact has led many of Maryland's most prominent citizens to support Open Gates in its mission.
I think one of the most important and one of the most basic ways to help people be and become productive and happy is to have a healthy life. So if you're healthy, as the old saying goes, if you have your health, you have everything.
Open Gates has brought about big improvements in a short time. Improvements that Peter Bielenson hopes can go even further.
We could probably use 10 more Open Gates around town to be able to provide access to care for the 150,000 Baltimoreans who today don't have any health insurance.
In order to respond to the needs in this community, need to finish our second floor in this wonderful building and bring in a full range of dental services, both for adults and children, and also to bring in expanded mental health care.
And to Marla Oros, it's exciting to see a vision come true.
Open Gates is truly an amazing and very, very special place. And it doesn't take fancy equipment, it doesn't take incredible research, it doesn't take the most sophisticated, highly specialized staff to make the kind of difference that we're making in the lives and the hopes and the futures of children and families that live in Baltimore City.